14-year-old young female presented with history of difficult in breathing. Chest X-ray performed. Frontal chest radiograph revealed a huge opacification involving bilateral hemothorax, left side more than right side. It is silhouetting the cardiac border and demonstrate the hilum overlay sign. The hilar vessels are still visible through a mediastinal mass. This indicates the mass does not arise from the hilum. Few tiny specks of calcifications within the mass. Suggestive of anterior mediastinal mass. Suggest. Contrast CT chest for further evaluation. A chest CT scan was performed revealing an enlarged heterogeneous fairly defined mass in the bilateral anterior mediastinum extending to superior, right middle and left middle and posterior mediastinum. The components of the mass were large areas of fat, multiple areas of soft tissue and few tiny specks of calcifications. It is seen also at level of the superior vena cava, tracheal bifurcation and aortic arch. Mass intacts with pericardium, bilateral anterior and lateral chest wall and left posterior chest wall. It was abutting with the brachiocephalic trunk, left brachiocephalic vein, bilateral pulmonary artery, bilateral atrium and bilateral ventricles. Posteriorly, the mass was abutting the aortic arch and pulmonary trunk also. Soft tissue components show post-contrast enhancement. Collapse consolidation of the bilateral lung is seen, predominantly in the left lung. There was no evidence pericardial invasion. No lung nodules in the visualized lung parenchyma. There was no extension beyond the thoracic inlet. No cystic components. No communication with the tracheobronchial tree. No mediastinal or hilar lymphadenopathy. No suspicious lesion in the bony skeleton. No pleural effusion or pericardial effusion. Conclusion. Huge mediastinal teratoma involving the bilateral hemothorax, left more than right side, associated with collapse consolidation of the bilateral lungs. No CT evidence of malignant transformation or secondary deposits. Suggest. Informed findings to surgical team. Multidisciplinary meeting for further surgical management.